It's time for your health check, and we know that October is Breast Cancer Awareness Month. We talk a lot about survivors, but have you heard the term pre-vivors? If not, you're about to meet two of them.
Pay attention.
At 73, Mary Bevel is a two-time breast cancer survivor.
First time I did lumpectomy and chemotherapy and radiation. Second time, because I'd had radiation, I didn't have a choice of any treatment but mastectomy.
Mary's daughters, Kristen and Lauren, remember the difficult diagnoses and days that followed.
It was very hard to watch as a 13-year-old and see how much your mom is having a hard time, but she was strong through all of it.
After her second battle with breast cancer, Mary made the choice to get genetic testing. The discovery inspired Mary to have another tough conversation with her daughters.
What we have is the BRCA genetic mutation.
Genetic testing revealed both Lauren and Kristen at high risk for breast and ovarian cancers. Their elevated predisposition to a cancer diagnosis because of family history puts them in a category called Pre-Vivors. Lauren, the younger sister, underwent a double mastectomy.
I very much just wanted to get it done, and so I sort of bullishly sped right into it,
which prompted Kristen to follow with a bilateral prophylactic mastectomy and hysterectomy. Doctors told her the surgeries decrease her risk of developing breast cancer from 85% to 1% and ovarian cancer from 65% to 1%.
I've always known it's not if I'm going to do the surgeries, it's when. And for me, my mental timeline was after having kids.
Kristen, who's now 38 and a mom of two, already knows genetic testing is in their future.
When they are older and we can actually have a conversation with them about what that means, I'd like for them to make the decision for themselves, but we would fully support and encourage them to do so.
A difficult but potentially life-saving decision for generations, inspired by a courageous mom and grandmother.
And I'm real proud of my girls for the decisions they made.
Now, when it comes to genetic testing, doctors at Mayo Clinic say not everyone needs it. You're a good candidate for the BRCA gene test if you have a personal history of breast cancer before age 45, have a relative with a known BRCA 1 or 2 gene mutation, or if you have one or more relatives with a history of male breast cancer or ovarian cancer. And by the way, this is just a starting point. If a gene mutation is detected, you and your doctor can certainly work through managing your risk together. That is your health check. Going to send